Have you ever found yourself pouring, well, just everything you have into your work, especially when it demands that deep emotional connection,
hmm
and you wonder, how can I keep going without completely, emptying my own tank?
Yeah, it's a really common challenge, isn't it?
It really is. So today we're taking a deep dive into a topic that's just absolutely critical for anyone providing mental health support.
Uh-huh.
But honestly, it's for anyone navigating emotionally demanding work. We're talking about the essential realm of self-care.
Yeah, focusing on personal well-being and, crucially, how that well-being directly impacts your ability to deliver effective, compassionate care.
Exactly.
And our mission today really is to pull out the most crucial insights from what we're calling our deep dive document.
Right.
We want to show you why recognizing the importance of self-care, developing a really personalized plan, setting firm boundaries,
Hmm.
identifying compassion fatigue, and engaging in continuous self-assessment, why these aren't just like optional extras.
Not just nice to haves.
No, exactly. They are absolutely foundational for your sustained capacity and your overall well-being.
That's right. And this isn't just theory we're throwing at you, we promise.
No.
We're getting into actionable strategies, a nuanced understanding that you can apply immediately,
Mm-hmm.
whether you're a healthcare professional or, simply someone trying to protect their own well-being in a demanding world.
Absolutely. So where do we start?
So let's start with what our source calls the foundational truth. Many of us kind of instinctively see self-care as a bit of a luxury.
Right. Something you do if you have time. Yeah.
Exactly, if you have extra time or energy. But what does our deep dive material tell us about why it's so much more fundamental, especially for folks working in these really demanding fields?
Oh, what's fascinating here is how the source, and it's specifically rooted in principles from a nursing,
Hmm.
mental health and community concepts. It points out that mental health isn't just like a piece of the puzzle.
Okay.
It's an essential component of overall health and well-being. It profoundly affects how we think, feel, act,
Mhm.
how we handle stress, how we relate to others. Promoting mental health, it says, is of vital global concern for individuals and for professionals like nurses.
Mm.
And it talks about the art of nursing,
Hmm.
involving compassionate, supportive relationships with clients.
Yeah.
But here's the catch. If that very compassionate engagement isn't balanced with self-care,
Right.
it can lead to pretty significant personal challenges.
And when you think about the inherent emotional toll of mental health care, that connection becomes, well, crystal clear. The actual content you're dealing with often involves stress, trauma, abuse, violence. It's almost impossible not to absorb some of that, isn't it?
It really is. And the source explicitly states that self-awareness and self-care practices should guide your engagement with that kind of content,
Okay.
precisely because it might trigger powerful emotions within you, the care provider.
So it's a protective measure, in a
Yeah.
way.
Exactly. And if we connect this to the bigger picture, it becomes really evident that without effective self-care, there's a significant risk. We're talking compassion fatigue and burnout.
Which aren't just about feeling tired.
No, absolutely not. It's a profound depletion. So prioritizing self-care allows professionals to maintain their well-being, yes,
Mm-hmm.
but also to uphold their ethical obligations to themselves.
Hmm.
And maybe most importantly, to ensure they can provide safe, quality, and dignified care for their clients.
Right.
It truly is about the people they serve just as much as it is about themselves.
Okay, so we've firmly established the why. Self-care isn't a luxury. But the burning question for a lot of listeners, I imagine, is how? How do you actually go from understanding this need to building a self-care plan that truly works for you? Our deep dive material offers quite a robust toolkit, actually.
That's a critical question, absolutely, because personalization isn't just about picking one strategy off a list, right?
Yeah.
It's about iterative integration,
Yeah.
finding what works for you and weaving it in. Our source outlines several really actionable strategies.
Okay.
It starts with something pretty fundamental, setting personal and professional boundaries.
Right.
This isn't just a suggestion,
Hmm.
establishing limits, physical, sexual, intellectual, emotional, financial. It's crucial for promoting psychological safety, and it reduces stress.
Makes sense.
For nurses specifically, this means carefully limiting self-disclosure of personal information
Okay.
and avoiding situations that could, blur those professional roles with clients.
That makes perfect sense. What else does the source highlight as foundational? Any other big ones?
Yeah, next up is maintaining a healthy social support network.
The people around you.
Exactly.
Yeah.
Caring relationships, healthy social connections, they're described as vital for building resilience and coping with stress.
Mm.
The source suggests purposefully connecting with friends, family, community, maybe even faith-based organizations. It helps reduce loneliness and isolation.
We often underestimate how much those connections really fuel us, don't we?
We really do.
Hmm.
Then, maybe more obviously, we have healthy lifestyle choices.
Okay.
This covers eating a healthy, balanced diet. Pretty straightforward. And engaging in regular physical exercise.
Right. Get moving.
Yeah. Even a brisk walk, some aerobic activity, it can increase endorphins, boost your mood, reduce stress, improve sleep, help manage anxiety.
Which, let's be honest, is often the first thing to go when we're feeling overwhelmed, isn't it? The exercise, the healthy food.
Absolutely. And sleep.
Yes. Sleep often seems like a luxury we can just cut short.
Precisely. Which brings us neatly to adequate sleep.
Okay.
The source really emphasizes striving for like 7-8 hours nightly, maintaining a regular bedtime, winding down properly before bed.
Putting the phone away.
Yes. Avoiding screens can significantly improve sleep quality.
Right.
These are sort of the bedrock,
Right, the foundations.
Building on that, the source also highlights mindfulness and relaxation techniques.
Okay, this is interesting.
Yeah, so mindfulness is described as a form of meditation using breathing and thought techniques to create awareness of your body, your surroundings. And it has a positive impact on stress, anxiety, depression. Meditation itself can induce calmness, improve concentration,
Reduces pain sensitivity too, apparently.
enhance the immune system, helps regulate difficult emotions, relieves stress, lots of benefits.
Wow.
Guided imagery is also mentioned using narration during relaxation breathing. And progressive muscle relaxation and deep breathing,
Yeah.
all effective stress management techniques.
It sounds like a really holistic approach. It's not just suggesting one magic bullet.
Not at all. And for those times when the stress is really acute,
Yeah.
the source introduces the WHO Stress Management Guide. It's called Doing What Matters in Times of Stress.
Okay, that sounds useful.
It is. It offers 5 really practical skills. First, grounding. That's about focusing on and engaging in what you're doing right now.
Okay.
Sort of unhook from difficult thoughts and feelings.
Right, getting out of your head.
Exactly. Then there's unhooking, which is recognizing when those difficult thoughts and feelings try to hook you, and then purposefully shifting your focus away.
So like refusing to let a pesky thought loop become the soundtrack of your day.
Exactly like that.
Yeah.
Then acting on our values. This means making conscious choices to act in line with your personal beliefs, even when things are challenging. Being kind, practicing kindness towards others, and really importantly towards yourself, that improves mental health.
Self-compassion.
Yes. And finally, making room. This is about allowing painful thoughts and feelings to come and go, kind of like weather, rather than fighting them, which frees up your energy for engagement. These are truly powerful tools for resilience.
They sound really practical.
They are. Other strategies mentioned include setting realistic expectations and positive reframing. Encouraging a positive outlook, viewing problems as opportunities, refuting those negative thoughts to minimize stress. Journaling is also mentioned.
Right. Getting it down on paper.
Yeah, a tangible way to record emotions, facilitate dialogue, set goals, evaluate progress, and spirituality.
Okay.
Engaging in spiritual or religious pursuits, prayer, time in nature that can provide comfort, hope, gratitude, a sense of belonging. It positively affects well-being for many people.
So a wide range of options.
Definitely. And finally, the source offers this really powerful framework. It's called the A's for building resilience, connection, and compassion.
The A's. Okay.
Yeah. So, attention. Becoming aware of your physical, psychological, social, spiritual health, including areas of gratitude and areas for improvement. Awareness, then acknowledgement, honestly reviewing what you've witnessed as a healthcare professional, the insights you've gained, but without invalidating your experiences.
Okay. Facing it.
Yes. Affection, choosing self-kindness, warmth, preventing bitterness and self-criticism.
Being kind to yourself.
Exactly. And acceptance, being at peace with all aspects of yourself, talents, imperfections. This protects against impatience, victim mentality, blame.
Wow. Attention, acknowledgement, affection, acceptance.
Yeah. These A's serve as a kind of overarching lens through which you can approach all the other self-care strategies.
That's a great framework. So it's one thing to know your personal toolkit, right? But what about those invisible lines we draw?
Ah, boundaries.
Yes. Our source really zeroes in on boundaries as a non-negotiable part of self-care.
Mm.
But why is something so seemingly simple so utterly fundamental, especially in this field?
Mhm.
For someone who's incredibly dedicated, wouldn't setting too many boundaries feel like pulling back from people who really need you?
That's a really common and understandable concern. But the source emphasizes that boundaries aren't about pulling back, really. They're about defining your comfort levels in interactions.
Okay.
They protect your well-being and limit stress, which ultimately allows you to give more sustainably, not less.
Right, so you don't burn out.
Exactly. For nurses, it's framed as a professional responsibility, using clinical judgment to determine and maintain these boundaries.
Okay. And what does that look like in practice?
Well, it includes key areas like limiting self-disclosure.
Right. Not oversharing personal stuff.
Precisely. Avoiding sharing intimate or personal issues with clients. It also means avoiding dual relationships.
Okay.
So not engaging in personal or business relationships with clients. And if roles might overlap, like maybe in a small community,
Yeah, that can happen.
you should openly acknowledge it, but always emphasize your professional capacity. Keep that line clear.
Makes sense.
Our deep dive document also details recognizing inappropriate boundaries. This is important. Being aware of signs like
Yeah.
flirting, keeping secrets with a client, believing you're the only one who can help them.
The rescuer complex.
Kinda, yeah.
Mm.
Spending excessive time speaking poorly about colleagues or the workplace, showing favoritism,
Okay.
meeting clients outside work, or contacting them via social media, those are red flags.
Got it.
And just for basic personal safety, protecting personal information like your last name, home address, personal phone number, social media handles, that's crucial.
Absolutely. And it flips the perspective too, doesn't it? Boundaries aren't just for the professional's protection.
No, they profoundly benefit the clients.
Right. Especially the source mentions for clients with personality disorders or maybe escalating agitation.
Exactly. For those clients, clear boundaries and limits must be set and consistently reinforced by the whole healthcare team.
Consistency is key there, I imagine.
Absolutely. This is done by using a firm, calm, and consistent approach, clearly stating expectations, outlining consequences for behaviors,
Okay.
which is very different from making threats, by the way.
Right. It's about structure.
Yes, it provides essential behavioral guidance and structure for the client. It helps them feel secure within clear parameters.
Okay. So boundaries are crucial. Now, here's where it gets really interesting, I think. You've been diligently working, you're applying these self-care strategies, setting boundaries, but how do you know when the cumulative effect of providing care starts to take its toll anyway? How do you spot the warning signs of something like compassion fatigue, maybe before it becomes overwhelming?
Yeah, that's a huge question. And compassion fatigue is explicitly identified in our source as something nurses really need to prevent through these self-care strategies.
Right. Prevention is key.
Definitely. Now, while the source doesn't list specific signs just for compassion fatigue itself, it does extensively detail general stress and mental health symptoms.
Okay.
And these are often direct manifestations of compassion fatigue. These are the crucial signs you really need to look out for in yourself or maybe in your colleagues.
All right. What should we be looking for?
Okay, so they fall into a few categories. There are physical symptoms, things like headaches, back pain, gastrointestinal symptoms,
Stomach issue?
yeah, fatigue, insomnia, changes in appetite, maybe getting sick more often, frequent infections or illnesses.
Your body keeping score?
Pretty much.
Yeah.
Then on the emotional and psychological side, you might see irritability, difficulty concentrating, maybe rapid, disorganized thoughts.
Feeling scattered.
Yeah. Feeling helpless. A perceived loss of control. Low self-esteem. Maybe loss of sexual desire, nervousness, even vocalized suicidal thoughts in severe cases. Emotional distress generally, and problems functioning in social situations, work, or family activities.
So it really impacts all areas of life.
It can, yeah. There can also be behavioral changes, like withdrawing from others, pulling away.
Okay. So if you see these signs cropping up.
That's a flag. Definitely a flag that something's wrong and needs attention.
So if you spot those signs, the strategies to actually mitigate compassion fatigue, they largely overlap with the stress management and self-care techniques we've already talked about.
Exactly. It's about being proactive with prevention, but also intervening when you notice those signs. It's not too late.
Okay.
And it's probably worth specifically highlighting those A's again here.
Attention, acknowledgement, affection, acceptance.
Yes. They're particularly crucial for dealing with this. They're designed to help healthcare professionals cope with what they witness day in, day out.
Right.
And to actively prevent that bitterness or self-criticism from setting in. This active engagement in self-compassion and self-awareness is just essential to counter the emotional toll.
It's about being as kind to yourself as you are to your clients, essentially.
That sums it up perfectly.
Okay. So we've explored the foundational need, we've looked at the personalized plan, the critical role of boundaries, and recognizing those warning signs. That leads us, I think, to our final key insight from the source. Self-care isn't some static destination you arrive at.
No, definitely not.
It's an ongoing journey, right? It requires continuous self-assessment and adjustment.
That's exactly right. Ongoing self-assessment and adjustment of your self-care practices are absolutely vital for sustained well-being. It's not set it and forget it.
Okay.
The source underscores this through several principles. First, self-awareness and self-reflection.
Knowing yourself.
Yeah, you're encouraged to become aware of your personal beliefs, attitudes, biases towards mental health care, to attune to your own feelings, your responses, your instincts. This even includes acknowledging personal histories, maybe abuse, trauma, adverse childhood experiences that might affect your professional reactions.
Right. Because that baggage comes with you.
It does. And the American Nurses Association standards of professional performance actually integrate ethics here. They state nurses should engage in self-care and self-reflection practices to support and preserve personal health, well-being, and integrity.
So it's actually a core professional expectation.
It is. Then there's the dynamic nature of it all.
Okay. Meaning it changes.
Yeah. Think about the nursing process itself. It's described as a critical thinking model, right? Requiring continual reassessment of the patient to detect changes.
Sure. You always evaluate and adjust the care plan.
Exactly. The evaluation phase asks nurses, were the outcomes met? Do we need to revise the plan? This iterative process inherently applies to self-care practices too.
I see.
What works for you today might need adjustment tomorrow based on changing personal demands, professional demands. It's never really done.
That's a great analogy. Your self-care plan is like a patient care plan for yourself.
Precisely. And finally, it's all about learning and adapting.
Okay.
Just like nurses continually improve their communication skills, stay updated with evidence-based practices, self-care should be a continuous learning process too. Your self-care plans should be dynamic, tailored to your evolving individual needs and life circumstances. Just like treatment plans get modified based on client progress.
So it's a living document for your own well-being.
Beautifully put, yes.
Okay. So this deep dive has really shown us that providing mental health support or really any emotionally demanding work, it demands a strong, conscious commitment to self-care.
Absolutely.
It's personalized, it's dynamic, and it's utterly essential for both the caregiver and ultimately for the recipient of care, too.
Definitely. And maybe we can encourage you, the listener, to reflect a bit.
Yeah.
How can you apply these insights and strategies to your own life? Whether you're a professional caregiver or just navigating the emotional demands of modern life, perhaps consider which of those A's.
Attention, acknowledgement, affection, acceptance.
Yeah. Which one resonates most with you today? Maybe that's a good starting point.
That's a great invitation. And as we close, here's maybe a thought to mull over.
Okay.
If our capacity to care for others is so directly tied to our capacity to care for ourselves, what are the broader societal implications of neglecting self-care in these professions? The ones that are really the bedrock of our collective well-being.
That's a powerful question. What ripples does that send through our communities?
Exactly. Something to think about.